Breaking Taboo podcast with your host, Serena Sun, Season 2, a podcast series centered around all things mental health. Hi everyone, this is Serena Sun with Breaking Taboo. I'm very happy to be sitting here with Monique. We will be talking about childhood trauma. So for those of you that might have missed it, we answered quite a few questions during the IG Live, and this is our opportunity to dive deeper into this topic, as well as just have a very open-ended conversation about childhood trauma. So let me introduce Monique to you. Monique Beglina is a psychologist based in Sydney, Australia, and has over 14 years experience having worked in child protection, out of home care, intensive family support, domestic violence counseling, and school psychology. Monique has a special interest in complex developmental trauma and trauma responsive care. Monique also has a passion for decolonizing therapy for the BIPOC community, and she also specializes in childhood trauma. So Monique, how are you?
Yes. Hello. Hi, Serena, and thank you for having me on your podcast. I'm very excited to be here and to, get into a deep conversation about childhood trauma. It's a topic that I love to talk about and can talk about for a very long time. So I think it will be great for us to be able to have this conversation.
Yeah, absolutely. Thank you so much for joining us all the way from Australia. What time is it over there for you?
It is, well, we're in the afternoon, so it's about 12 o'clock in the afternoon here.
Oh, okay,
So
okay.
it's a bright sunny day outside, and definitely going to go for a walk after this.
Very nice. It is about 10 o'clock here, p.m. at night.
Very
The
late.
East Coast. Yeah. So I always like to just, get a sense of the different people that join our podcast and our community in like different parts of the world. It's always
Mm,
interesting to hear of,
yes.
the other side of things. So, yeah, because mental health obviously is something that affects everyone everywhere, regardless of culture, boundary, borders, boundaries, religions, countries, nationality, ethnicity, sexual orientation. It doesn't matter. Mental health affects everyone because we all have mental health, right? So there's a lot of
Yes.
similarities regardless of where you are, whether Australia or here. And one of the similarities, regardless of where you were born, is childhood trauma. We all of us adults were once children, and going through childhood, which in this case, Monique, as you said in the IG Live, childhood is we're talking about from birth until age 18. So
Yes, that's right.
when we're talking about childhood trauma in this episode, that's what we mean. So yeah,
It can
childhood.
even be in utero as well. So
Oh,
I
okay.
do look at the impact of trauma on development in utero, and the research around how trauma in utero can actually impact childhood and adulthood as well. So
I
in
love
utero
that.
to 18, I say.
Yeah, no, let's dive into that too in this episode, because once you said that, that just brought up a whole bunch of questions for me.
Yes.
So that's something I have not really researched, or I don't know much about that, although it is fascinating. So we'll dive into that as well. But yeah, so childhood trauma is something that affects many people. One in every three children, right?
In some geographical areas that might be higher, and some that might be lower. But what that study was about was to show that approximately a third of the classroom, those children have experienced multiple incidences of trauma or been exposed to multiple incidences of trauma. So, really, it's about bringing them to the forefront of education and learning, and catering to, making sure that adjustments and support are put in place in our schools, making our schools trauma informed and trauma responsive. So, that was what that study was about.
Got it. Yeah. And we're talking about complex trauma with that as well, right?
Yes,
Okay.
yes. So we were talking about complex trauma and reportable trauma, so trauma that was then reported to statutory services. So what we know is that trauma is underreported, and you
Mhm.
know, we know that the rates are much higher than 1 in 3, but this study was based on statistics from reported um,
Right.
incidences. Yes.
And can I ask, is this done in Australia, this study?
No, it was actually
Oh.
from the US.
Oh, okay,
Yes,
okay.
yeah, so
Okay,
from the
yeah.
US, we just go by what you guys do over there, 'cause we, yeah, we go by a lot of US research. I use a lot of research in my work, because we just don't have the same, accessibility, I think. But we do there are some, people who do research in Australia as well, but I think
No.
it's a lot of the research from the UK and the US.
So we're talking about complex trauma here with children who are prenatal to the age of
Mhm.
18. And the research that you're quoting from are from children that have actually been reported, right? The trauma has gotten to the point where it's gotten so bad that Child Protective Services has had to come in, and they are the ones reporting this. So again, just think about how few incidences like it gets actually reported, and out of that,
Yes.
how many children out there are probably going through childhood trauma where no one really knows about it outside of the home situation, or whatever situation they're experiencing it from. So again, we just want to emphasize that the probably is very underreported, and
Mhm.
that the amount of childhood trauma, complex childhood trauma that we're talking about is probably a lot more than one third, but currently, right now, we only know about the one third.
Yes, that's right, and we do know that it is underreported,
Mhm.
just like we know that domestic violence rates are underreported
Mm.
and sexual abuse rates are unreported. So when we're talking about, trauma that's occurring within the community, we know that the statistics and the research is limited and has limitations because it is based on disclosure or people, you know, naming it and naming their experience. And that's a really hard thing to do when we're talking about such a vulnerable and sensitive topic and area.
Right, and with, like, any type of trauma, domestic and childhood trauma, the people who are the victims of it are often scared to report it, it's
Yes.
especially for a young kid where all they know is their caretakers. Where are they going to go,
And
So
they're naturally going to be protective of their caregiver. So to be able to make a disclosure takes such vulnerability and, takes this different mindset of, you know, being able to step out and because it's often to someone outside of the family unit that initial disclosure occurs. That's a
Mhm.
really difficult step to do for children because often is the case is that they are protective and so they don't talk about what's happening in the home.
Right, of course. I'm sure there's a lot of guilt involved as well, to report the people who are supposedly your caretakers. That takes a lot. Not to mention, we obviously don't have the best child protective services out there. No child wants to go to a foster home,
No.
or something that's like very scary. That's extremely, extremely scary. So
Very
unfortunately, there are
scary.
all these factors that come into play that again attribute to the underreporting of childhood
Absolutely.
trauma.
Absolutely.
But if childhood trauma continues, and a person into adulthood and they don't heal the trauma, right? So we were talking again a little bit about this in the IG live. I just want to dive deeper into this with a question that we left off at, which was, how much of that do you think can lead to actual diagnosable mental health conditions? So basically, the mental health conditions that are diagnosed later on in adulthood. And I know that there's not a lot of research on this, but just based on your experience and your thoughts, how much of that would you say are actually because of childhood trauma?
Mm. When someone has a trauma background. So when trauma has been part of their experience, whether that has been in childhood, adolescence, or adulthood, I attribute the state of their mental health to their trauma experience being a really large factor. And often, what can occur is, um, there is, some mental health screeners and assessment tools that unfortunately don't screen for trauma or don't assess for trauma. So it does take a mental health clinician to purposefully be able to do that screening and that assessment outside of those screening tools. So we can see diagnoses, borderline personality disorder, for example. What we know is that there is a high comorbidity rate for that diagnosis with trauma. And
Oh,
so what we're seeing is that diagnosis doesn't often isn't often associated with trauma, but the rates of people who have that diagnosis with childhood trauma is very, very high. And so, really, I see it as a trauma diagnosis. The same with oppositional defiance disorder, which is often what children are diagnosed with when they have really disruptive behaviors in school or
what is that?
within the family home. So this is when children um,
Act out?
they they act out. They often seek that sense of power and control through outward behaviors, and so they are very disruptive.
Mhm.
They, don't follow the school rules or the classroom rules, or just appear very defiant towards their teacher or their caregiver.
Mhm.
And it can look like they're being just really naughty and misbehaving, when in fact, again, for me, that's a trauma experience and trauma behavior. And
Mhm.
what we
Yeah.
know is that diagnosis comes with high rates of trauma. And so there's a school of thought amongst psychologists that some of these diagnoses do need to be reclassified or reevaluated for the role trauma plays, and maybe that might change diagnoses that the children and teens are receiving, particularly in
Mm,
this
yeah.
case. And so, because when we look at labels and when we see people through labels,
Right.
that can often change the approach from schools or caregivers or systems towards that individual.
Right.
When we look from a trauma informed lens, wow, does that change the way we approach how we interact with that individual or support that individual? And
Right.
so,
Right.
I'm very passionate about, when we look at being trauma informed is one part of the picture. It means having the education on understanding what does trauma mean, how can it present, how can it look like in the system, whatever we work in, whether that's school, mental health, um, whatever that might look like. And so what we need to do is also be trauma responsive. How
Mhm.
are we going to put our education of what trauma looks like and presents as
Mhm.
into
Mhm.
action? How are we going to respond differently to a child who's experienced trauma or a teen who's experienced trauma?
How
That's the important part.
Yeah, I feel like that's really difficult because, first of all, you know, I'm assuming it would be dependent on the type of trauma they have experienced. Second of all, like, how do you, I mean, besides a psychologist or therapist or somebody actively working with the child, how would you know right? What type of trauma they've experienced, and how would you link that behavior to trauma? Because, oftentimes if a child's acting out in a store or, in a party or a school or a place where like people may not be informed, it
Mhm.
really does come across as just bad behavior, you know?
Yes.
So, and then the other side of that also is, yeah, what do you do? I'm sure there are a lot of different methods based on, what type of trauma that child has experienced. So, it's
Mm.
difficult. So, what would be the easiest, I guess, most overall general way that someone could help with someone that they suspect may have had childhood
Yeah.
trauma?
You've raised a really important point because we will never know, every single child's background and what they've experienced. And we will never know every single child who's experienced trauma that crosses our path.
Mhm,
And because trauma can present in so many different ways, there will be some children who don't exhibit signs that they've experienced trauma. And so internally,
mhm,
they may be distressed. And what we have seen from neurofeedback research is that we can see children who've experienced trauma internalize, but their brain waves are just really chaotic and up and down, like children who show those external signs of trauma. So, on
mm,
the outside, we would think nothing is going on for this child. They're coping and they're managing really well. But inside, their internal experience is they are quite distressed.
mm,
Um, and so, this is why when we talk about building trauma informed schools or trauma responsive systems, it's about generalizing our approach to cater for all children who may experience trauma. And so, we're building into practice those responsive strategies into our policies and our practices and our procedures to be trauma informed, because we're not going to know every single child who's experienced trauma, right?
yeah.
Um, and so, how do we do that? It's really key in terms of building safety within our systems.
How do you do
Um,
that?
it's a big task. Believe me, it's a big task, but it does mean really reviewing the policies and practices that are in place. And so, I can talk to being in schools because that's my area that I'm in at the moment.
Yeah.
When we're looking at building trauma informed schools and trauma responsive schools, we're looking at, what are the daily practices that occur that can support children to feel safe at school. And so,
Mm,
whether that's creating things like calm spaces, providing teacher education on trauma behavior. I do a lot of training for teachers on trauma informed teaching, and I'm not teaching them how to teach because I'm not a teacher. I'm not
mhm,
skilled enough to do that. I'm teaching them how to understand trauma behavior, how
mm.
to recognize the signs, and how to support regulation in the classroom. So,
Can you list
when
some
we're
signs?
yeah, so some signs might be, our children who are really hyper vigilant. So they're constantly looking around the classroom and they can't do their work, they can't focus on their work because they constantly need to see their environment to know that they're safe. And
Mm,
you'll have some children who they can't sit with their back against the door because they need to be able to see the door to see who's coming into the room. So the
mm,
minute anyone comes into the room, they're quickly looking to see who they are. Um, children who can escalate quite quickly in their behavior. So they might be seeming quite calm and engaged, but then all of a sudden they might be really disruptive and disengaged and throwing things around or
mm,
getting into fights with their peers, can be a sign that they're emotionally dysregulated and not coping because they have become triggered.
mm,
Um,
mhm, mhm,
I've also seen, when we're looking at the other end of the spectrum, our internalizers who aren't showing those outward symptoms, but they're not engaged in their learning. So their internal experience is getting in the way.
mm,
And so it is impacting them, but they're not outwardly showing through their behavior. So they might be looking like they're calm and engaged and going okay because they're quiet, and they often can go under the radar. But what you can notice is their work isn't at the same level as their peers, or they're not completing tasks, or they're easily distracted. They might be walking around the classroom a lot. They might be talking to their peers a lot.
Hmm.
They might be seeking connection and attachment from the adults in the space. So, I've worked with students who can appear, what we would describe as clingy, right? So they just need to be glued to the teacher's hip, and they don't want to leave the teacher's side because the teacher is that safety net for them. I could go on. There's so many different ways that children can present with trauma behavior
But I think
in.
it's so important and fascinating for people to understand this. It's yeah, it gives a whole new meaning to the word clingy. If
It
people
does.
understand that, yeah, it's sometimes could be because the child is not safe at home.
Absolutely, and because they internally feel unsafe in that moment. So it might seem like, again, and this is what I mentioned in the live, that we can be in a safe environment and yet still feel unsafe internally. And that is an impact of trauma,
Yeah,
because our brain will not know the difference. And so it will just tell us that you're unsafe, and we
right,
will feel unsafe even when we're in a safe situation. And
right.
so in those moments, children won't know why they don't feel safe. All they know is that they have that feeling.
Mhm,
And so they will seek that connection and
mhm,
that attachment from the adult that's nearby.
mhm,
And to go back to the overarching question of, how can we be responsive to be trauma informed? It's creating safety in relationship. That's the number one thing that I focus on. It's where I start when we talk about how do we support systems to create trauma responsive care. It starts with creating safe relationships, no matter what the setting is. So that a parent, a caregiver, a teacher, a coach, a priest, whoever it might be, it's
mhm.
about creating safety in that
How do
relationship
you
first.
how do you do that? Like, what does that look like, and what do you not do? Yeah.
Yeah, so it's getting to know the child at their pace,
Mm,
and not pushing them beyond their capacity. So it can again be really difficult to form relationships with traumatized children because they push adults away, because in their worldview they see adults as unsafe.
mhm,
And
mm,
so we're needing to remodel that and reteach that adults can be safe. And that's hard work. That's really hard work, because it means, coming into this relationship with this child or teen over and over again, modeling that we can be safe, and how we can do that. We need to be predictable.
mm,
We need to respond to the child the same way, with a calm tone, with this, being that soothing presence,
mhm,
not being reactive,
mhm,
being able to respond and meet their needs throughout the day. This
mhm,
is what predictability means, so that the child knows, I know how my teacher's going to respond to me because they always respond in the same way.
mm.
And this is really important when we want to build safety in relationship, because children who've experienced trauma are very used to chaos and not having that sense of predictability, because their caregiver may have been unpredictable in how they've met their needs or
Mm.
responded to them. So, again, we want to reteach and remodel so that we're forming those neural pathways in the brain to show them that there are safe adults out there in the world who do care and love them. And, you know, that's part of the trauma healing work as well,
Yeah.
because we want to model that sense of safety in relationship for them, so that they don't take that worldview and transfer it to all adults. They can learn that that was situational to that relationship or that period of time.
Yeah, I think a child would be very lucky to start healing that earlier on, during the ages of before 18, because
Yes.
a lot of these things I see also in adults, and it's a lot harder to do what you said, basically reprogramming the learned conditioning, right? So it's so much harder when you've been living with that for so long, and then in as an adult, then you heal it. So not to say it's not impossible. Obviously, it is very possible, but yeah, I think a child would be very lucky to find someone, a teacher or a caregiver or someone that understands what you're saying and is able to give them the things that it sounds like that child has not been given that they so desperately need.
Absolutely. It's
Yeah.
powerful. It's quite powerful. And, I do talk to teachers about the power in relationship that they have, because they, outside of the home, are the next adult who spends the most time with their
Oh,
students, with
true.
this child, right? And so they're really that next attachment relationship outside of the family unit, um,
Wow.
because the child spends so many hours of the week with them. And in primary school, this is probably more primary school than high school. In primary school, it's that one teacher for 5 days.
Mm,
So,
right.
that's consistent caregiving that the teacher is giving this child, which is why there is power in creating that safe relationship, and that being part of the healing journey for children who've experienced trauma, because that's a great opportunity to remodel safe relationships for kids.
Wow. Yeah. Yeah, that any teacher would be lucky to, I guess, learn about the ways to heal childhood trauma and to have you. It sounds like what you do is you train them in how to do this, right? So yeah, there absolutely should be more training around this, because again, it's very common. Childhood trauma is a lot more common than you
Yes.
think. The other thing I wanted to ask, so this kind of leads into, you keep talking about relationships, right? So there was just also, we kind of dabbled on this in the IG live, but how much of this really affects adult relationships? You're talking about the way that it comes out in childhood, but in adulthood, in an actual adult romantic relationship, what are the ways that the childhood trauma can manifest itself in
Mm.
adult relationships? What does that look like? What can you look for? Oftentimes what happens is childhood trauma leads to avoidance attachment, anxious attachment. And I think it's interesting that you actually said that that actually happens in childhood, because you said the clinginess, right, which would be an anxious attachment style, and then
Yes.
the pushing adults away, which would be an avoidant attachment style.
Absolutely.
And we
Yes.
see that, in romantic relationships too, all the time. And that's why people have problems that continue in romantic relationships regardless of the partner. Oftentimes it's because they're carrying that over, and they have the anxious attachment style or the avoidant attachment style. So yeah, but those are just two things. I'm sure there's many other ways that it can manifest. So what are some things to watch out for?
Yeah. So, that was a really great point, Serena, because, what we talked about in the live was that our attachment style is formed in our childhood, in our infancy.
Mm,
So, when we look at how do we go into relationships with our attachment style, well, we need to look at what was our experience of our infancy in our early childhood years, because that was when our attachment style was formed with our caregiver.
mhm.
The power in that relationship to have long lasting impacts is huge, because we're talking about the impact of how we were parented in our intimate relationships. And it sounds odd, but it's really not, because it is our first experience of relationship,
Mhm.
and it's how we view and see others in our world. And of course, that transfers out into our then intimate relationships or our personal relationships. And so, yes, there are the 4 different attachment styles. So, the secure attachment style is when we have experienced in childhood all our needs being met appropriately and on time. Um, you know, the anxious attachment style is often when we have an anxious caregiver as well. And so, you know, our caregiver has been anxious about meeting our needs, and it's been not consistent. Our needs weren't met consistently.
Mhm.
Avoidant is when our needs weren't met.
Mhm.
And so we learnt that we don't express our needs because our needs don't get met.
Mhm.
And so we learn to push people away. And we have to self soothe or self identify our own needs and only meet our own needs.
Right, where
And
you learn
then
that, yeah, you can't depend on
can't
other
depend
people
on
for your
other
needs.
people
Yeah.
because they won't meet our needs for us. And then disorganized attachment is when we learn that in relationships we can experience love and we can experience hurt.
Mhm.
So this is often when, you know, abuse has occurred in that attachment relationship. So we've learnt that with love comes pain,
Mhm.
and then that creates a disorganized attachment,
Oh, that's so interesting. I haven't heard of that one, but I have heard of the fearful avoidance as another style where
which is the
yeah.
same, often called interchangeably.
Right. Oh, okay, I see.
Yeah,
Okay.
yeah, yeah. So there's different names for it depending, I guess, on what research you're reading.
Mhm.
Um, but yes, so that it's about being fearful in the relationship, but also experiencing there are moments of positivity as well.
Right,
Um,
right.
well,
So
can be sometimes not.
right. Right, it's kind of like a going back and forth between the
It
anxious and the avoidance type.
Yes,
Yeah,
yes, because
where
often, parents often ask, when children have experienced abuse,
mhm,
how can there still be an attachment relationship there? And this is why attachment is, so fascinating to me because even when the majority of the experience has been fearful, if there've been moments of bonding that have occurred, that
mhm,
is where attachment formation occurs.
mhm, mhm,
So what we've seen in the research, and when I worked in out of home care, which is foster care, what the research showed was, you know, if you asked a child who's being abused, do you want to stay in your family home or do you want to go into a foster care placement? They will always choose their family home because that's the attachment that they know.
mhm.
So even though it's
Also,
a
foster
pain,
care is scary. I mean,
well,
nobody wants
yes,
to be
exactly
without
right,
parents,
exactly
yeah.
right. Yeah, so
What child would want to go without parents? That's, like, probably the scariest thing for a child to think of.
and even if they know they're being hurt and they know that it's
Mhm.
painful, it's still better than the unknown.
Right, but
Um,
there's also a lot of, stories about bad stories of foster care. I've read books of one of my favorite books, White Oleander. Have you read that?
no.
It's so good. The writing is just so good, but it's about a child, uh, that goes through the foster care system, and the experiences are just horrible. They're just so traumatic. Each foster
They're
parent is just there's very few that were actually good, and that is supposed to be, obviously, a look at the real foster care system, and from what I hear, it's kind of like that, so yeah.
it is absolutely, and what we know is that with each placement change, so with each change in foster care placement, that is creating a new trauma for the child. It's a
Right.
new trauma experience.
Oh, wow.
And so, I hear the stories. I've worked with the children who have experienced 15, 17 placements in a short amount of time. And so being in the foster care system itself is traumatizing, can be
Mhm.
traumatizing.
Mhm.
Um,
Yeah,
and so absolutely, I know that there is
definitely
a
not
lot of work
perfect.
that needs to happen there too.
Yeah, because it
Um,
kind of almost sounds like, there's like, what do you do? There's trauma
Yes.
here, but then there's trauma here too. It's almost like guaranteed trauma. I mean, what seriously, there needs to be a lot of work
A lot
to
of
be done
work.
in this.
Absolutely, absolutely. And so I know you mentioned, how does your attachment style then impact in adulthood? So when we know our attachment style, we can see it play out in our adult relationships, because what we do is we actually seek to replay those childhood relationships and connections. So
Yeah, why
if
do people do that? Why do people go back to the trauma? I forget what is the term for that? Where they revisit trauma, and it's very common because
yeah,
it's comfortable for them, right? That's the reason.
it's it's the familiar, it's
Mhm,
the known.
mhm,
When we think about stepping outside our comfort zone or changing things to what we don't know,
mhm,
that creates fear.
mhm.
And even if there is unpredictability and unsafety in relationships, when that's known to someone, that's their norm, that's their comfort zone, which can
Right.
sound really odd because you think, but it's painful and it's hurtful. But when that's what someone has experienced for majority of their life, they know that life is unpredictable, or that relationships are unpredictable. And so there's comfort in that for them because this is what they know. And
Mhm.
so then they will seek those kinds of relationships until some healing work is done to really integrate that trauma and view that trauma as trauma, right? So to be able to see that this was a traumatic experience for me, we tend to replay and reenact
Yeah,
those
that's so
scenarios and
fascinating.
those situations. And so we do see, that there are multiple relationships that might present the same way, until some of that healing work has been done.
Right. Right. And, this kind of leads into the other question I think that we said we were going to dive a bit into during the IG Live as well, which was, and I know this is probably a tough question, and you may not have a clear answer for it. I don't even know if there's a lot of research that has been done for this because. The other issue with mental health is and psychology and therapy is that there is very limited research to other cultures. Relationships and family structures are just so different. The norm
Mm,
is so different. And what is considered abuse and not abuse is also different. And what is considered healthy and unhealthy is also different. And I think that adds another layer of complication to the term trauma, because in they are very some cultures are very passionate
mhm,
cultures that tend to argue a lot and fight a lot, and that's like the norm, and I also know that in obviously in psychology and therapy, just because something is normal does not make it okay, right? That's
mhm.
something that is very that every therapist advocates for. But with that said, it is true. I mean, I even in seeing like TV shows or knowing people and just my culture and, which Eastern versus Western, the level of what is considered traumatic is very different. So,
Yes.
how would you go about solving that huge, complex issue as well?
It is so, so difficult. It's so difficult because what we need to make place for in the session, in the therapy space, is cultural differences or cultural expectations and cultural norms. And this is where decolonizing therapy really is, um, a great lens to have, is because we're not using a Eurocentric lens. We're not looking at the Western lens and applying it to a cultural, context. Because when you do that work, the person or the individual becomes disconnected from you.
Mm,
Because
they
I'm
don't
also
relate.
from Well, that's right, because they're saying, well, you don't understand how my culture looks and how it fits for me and my identity and how we interrelate in our
Right.
culture. So our cultural norms for interactions look different, and you're putting a Western expectation on this, and that just doesn't work for me. Um, and so, for me, I also am from a culturally diverse background. My family has many different cultures in it. And so for me, as I was being taught
Mhm,
psychology through university, there
mhm,
was a discord to my experiences coming from a culturally diverse background.
mhm,
And so that lens of what we're taught at
mhm,
university, and how we're taught to operate in the therapy space
mhm.
didn't apply. It just didn't work. Um,
Yeah. Do you know, what I find really interesting is that I know that in modern day Western therapy, one of the major things that therapists work with their clients with is getting that sense of individuality and
mhm.
independence, right? So there's a ton of that, and that's extremely Western, especially the independent part, right?
Yes,
Because,
yes.
and I say this especially because it might be fresh in my mind, but I just finished watching Netflix Indian matchmaking. I don't know if you've ever
Ah,
seen that
okay.
show.
I haven't watched it myself.
So people have been telling me to watch it. They're like, it's a good show. And
Okay.
I finally watched it and I like binged it. But it was just so interesting because the parents were in every single aspect of the decision making from
Mm-hmm.
start to finish, right? So they would meet the potential other person oftentimes with the parents involved. First, you have to get the parents' approval. Like there's a lot of factors involved, and people even, they even married people or considered this the matchmaking for their parents. There, I think there was someone in there that was saying like, I'm not doing this for me, I'm doing this for my mother,
Yeah,
right? Like
yeah.
I'm personally, I think he was the age of 20 something. He wasn't even 30 yet. And he was saying, like, I'm not ready for marriage, but my mother wants me to get married and she's getting really worked up about this and anxious about this. So I'm going to do it for her. And that's just what was accepted in the culture. And I was thinking, I'm sitting there watching this, thinking the whole time, wow, if this was a therapy session, that is not what the
Right.
therapist would be saying. The therapist would be working on this is called enmeshing, right,
Yes.
in therapy, so which is a bad thing. Being enmeshed in a family is a bad thing
Yeah.
in therapy. So the therapist most likely in the Western world would be saying, like this is not healthy dependence, like this is
Yes.
unhealthy for you to care so much about your parents and what they think, and you should be doing this for yourself, and da 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 da. So
Yeah.
again, that kind of goes, and that's literally what they would be working on in their therapy sessions.
Working on individuating, and that's counteractive to the cultural norms and the cultural upbringing for many people from culturally diverse
Right. But
backgrounds.
see, that's the part where it's such one of those the questions that I've been even myself like struggling with and thinking about, which is what I asked earlier, like where is the line of healthy and
Mm,
unhealthy, and the line of just because it's normal does not make it okay.
that's right.
So I don't think there's a clear answer on this. It may actually in fact have to do with the individual, and what makes them happy, that maybe it is more individualistic like that. And at the same time though, what does make people happy may not be to say no to their culture,
Yes,
or
that's right.
turn their backs on the things that they have valued or they were taught to value, so
Yes.
I don't know, it's very complicated.
It's navigating the pathway, right, of combining, I guess, the two worlds. And it is living in two worlds, particularly when we live in a Western country. So I know, Australia's Still very much a Western, well, it's a colonial country. You know, we were colonized by Britain, and so a lot of, you know, the cultural norms and expectations are very Eurocentric. And so when we look at, you know, in the therapy space, you know, with the BIPOC community, it's navigating this journey and this pathway of combining the two worlds, because it doesn't have to be either or.
Mm-hmm.
And it's not about one dominating the other. It's how do we cohabitate with the two cultural worlds,
Right.
and finding that safety or that safe space from therapists who make space for
Mhm.
culture. And this is really key, because not all therapists do,
Not at
and
all.
not all therapists will guide that. And so finding a therapist who will do that is really key. And I think there's, you know, this outdated myth out there that, you know, we can just apply general psychology principles to everyone.
Right.
And we
Right.
can't. We
Right.
can't, you
I
know.
personally even know of so many therapists and clients, just individuals of the Asian culture who have stopped therapy or who have searched for a different therapist or have had bad experiences with it, just because, you know, they're often taught to cut off their family in
Yes.
more words or less, you know,
Yes.
basically that's
Yeah. Yeah.
because there are many aspects of and I'm just speaking from my culture, there are many aspects of my culture that are viewed as unhealthy. I'm not disagreeing with it, you know.
Yep.
However, I do think that it's a lot more complicated than the black and white
It
of
is.
of like what's going on right now in most therapist offices. So
Absolutely. And it can't be as simple as let's take out that piece of the puzzle, right? So that you can then individuate and find your own success in the world,
right.
you know. And often
Right,
is the
that's true.
case. Cut out that relationship.
Mhm.
Move
That's
on.
that's what I've been finding most Western therapy centers on that, actually. And it's actually led me, and this is a totally different conversation, but I was thinking of even writing an article about this, but it's led me to really think about how cancel culture is such a part of Western culture, to the point where like I'm even seeing it in therapy. You
Mm-hmm.
know, it's kind of like that. It's kind of like, okay, then just cancel them.
Yes.
You know, oh, that's unhealthy for you. Okay, then just block them out. For me, I kind of feel like that doesn't actually breed good, healthy relationships. Like for me, I'm like, if you are learning to just avoid, it's another form of avoidance, right? To just
Yes.
cancel people and avoid them and just and not deal with them and not figure out ways to be able to have relationships with, say, all sorts of different types of people, besides like the most extreme, you know, or dangerous ones, then I feel like actually that might not really be beneficial to, you know, your mental health, you know. But that's just me, that's just my feeling. I know some people might feel differently.
Yeah, there are definitely different experiences, even from within the BIPOC community, or on how they view family relationships. But, you know, I think a key to the BIPOC community is that culture is at the core of our identity.
Mm-hmm.
And that's instilled in us through family relationships and ancestry.
Mm-hmm.
And so it can't be, it's not always as simple as cutting out a relationship
Right.
when that lineage is more than just that one relationship anyway. And and so there comes the issue then in the therapy space, right, where you may have someone who doesn't understand or make space or prioritize that as the part of the conversation in working towards the healing or working towards strategies, um,
Right. Right.
because then it becomes about, well, how do you protect yourself, rather than how
Mm-hmm.
can we work on this and make space. And even if it is an unhealthy relationship, which there are absolutely unhealthy relationships in families,
Mhm. I
but
would say most families, it's not just, a Eastern or Western cultural thing. I think
definitely
I
not.
think most families actually go through,
Absolutely.
yeah,
Right?
times of
Because we're all
healthy and
human.
unhealthy. Right.
Yeah, yeah, we're all human. We all have our own issues and we all come with things into relationships, and parents have their own trauma from their parents, and it continues.
Childhood
Um,
trauma.
yes, yes. And so, making space for that intergenerational impact is really important.
Mhm. Mhm.
As well as, the systemic impact of, you know, we operate within systems. We do not just go out into the world and just be us on our own.
Right.
We have to, you know, be with our employers and our colleagues, and we function in an educational system or a legal system or a political system or a health system.
Right.
We're part of so many different systems, and so those systems impact our mental health as well. And the
Right.
policies and the practices of those systems, which may be racially biased,
Mhm.
um, will then also impact our mental health. And so making space for that in the therapy room is really important. And again, it's not something that all therapists do.
Right. Right. Absolutely. Yeah. I mean, yeah, I wasn't planning on getting into that discussion, but I'm
No,
glad that we
no.
did. I'm glad that we did, but I know we have to wrap this up, but
Yes.
unfortunately, I do have those two questions that are still, in my mind. If maybe we could just go through them a little bit more quickly. I don't know if we can. We'll see. But one of it is so we talked about the attachment styles that
Yeah.
come out to later on in the relationships. I just wanted to ask, what are some other signs that people can look out for if they're in a relationship with someone that has gone through more severe childhood complex trauma?
Mm.
Like, how does it manifest? What are certain things? I can think of one, which is that person is easily triggered by
Mhm.
a lot of different things.
Yes,
What else?
yeah, which is a great thing to notice, because we can often say to other people, "You're overreacting." And I truly believe that there is no such thing as overreacting. We react within our means of coping. And so if we're seeing a big reaction to what we think is a small problem, there's more to the story, there's more underneath that reaction that we don't see. So often, when we're talking about adult relationships and people who've experienced trauma in those adult relationships,
Mhm.
it can seem like their partner may be overreacting. But, we need to look at the context of their experience, and maybe what they've experienced in their childhood has come up and has been a trigger,
Right,
creating that sense of internal unsafety. It's
right.
not a word, but I'm just making it up as I go.
The perceived
But they feel
danger.
unsafe, right?
Right,
Internally unsafe.
right.
And so that creates this really big reaction, because it's a survival mechanism that's kicking in. It's not about overreacting as a way to monopolize the relationship.
Mhm,
It's about, I feel unsafe and I don't know how to cope, and this is the only way I can express that.
mhm,
So
mhm.
that is a a huge impact of trauma and how trauma can show up in adult relationships. I
Right,
mean, trauma can show up in adult relationships in so many different ways, and those attachment styles are probably the guidelines in terms of how it can be so different. So you can have people who can't communicate their needs or don't know how to communicate their emotional needs.
mhm,
And so
mhm.
they may shut down, they may push people away, they may seek to just deal with it on their own or bottle it up, or not go there, because addressing the need or communicating the need takes a certain level of vulnerability, and that can feel unsafe to
Mhm,
people who haven't experienced vulnerability in their childhood, or had the space and support to be vulnerable in childhood to express their needs. So then they don't know how to do that in adulthood.
or they may be dependent on the partner for fulfilling their needs, without even expressing it. They may have an expectation of the partner fulfilling those.
Yes.
And speaking of communication, I think another one would probably be they find it difficult to communicate. They might shut down instead of communicating, or they might be scared of having open conversations. Here at Breaking Taboo, we're obviously huge into communication. Our slogan, kill silence, save lives, like so many things are a result of poor communication or no communication. But I think trauma definitely leads people also to have problems with communication or
Yeah. I mean,
avoidance
if you
of it.
think
Yeah.
about, our childhood experiences of trauma shape the way that we learn to face challenges or difficulties. And so
Right.
when we learn, from various different experiences, that the way that we face conflict is to shut down or avoid or walk away, then that's what we'll do in adulthood.
Hmm.
And so, unless we heal and work on the trauma and address the
Hmm.
trauma,
Hmm.
um, and
Right.
so it shapes the way that we operate in the world as an adult.
Hmm.
And those behaviors do then transfer into adulthood,
Right.
because
Right.
it's what we've learnt. It's how we've learnt to face difficulties or face social situations. It's all we know in how
Hmm.
we've learned. So we won't do differently unless we learn differently.
Right. Absolutely. Absolutely. So yeah, one last question before we wrap up, which is the one that I had mentioned before that promise we get to it. The prenatal one.
Yes.
Prenatal. So what are just,
Yeah.
maybe some examples you could list of what is prenatal trauma? What
Yeah.
causes prenatal trauma? If there was an expectant mother out there who
Mm.
wants to make sure that her baby doesn't get traumatized
Mhm.
in her belly, right? Of prenatal stages. Yeah, what would you tell her? What are
Yeah.
some do's and don'ts?
So what the research shows is that in utero, the experience of the mother's state of stress can
Mm,
impact brain development in utero, because the brain's already developing in utero.
how
And so
interesting.
when a mother is experiencing distress or stress from being exposed to trauma, let's use domestic violence as an example.
Mm,
So she will have a heightened state of stress throughout the pregnancy. And what's happening in the baby's brain in utero is the baby is developing that primed view of threat and danger because
oh,
of the
wow.
mother's experience. And so what has been seen in research is that when babies are born, their brains are then already wired on some level for threat and danger due to the in utero experience.
Wow.
Quite
Yeah, that
fascinating.
that adds a whole other layer because you know how usually people say it's either biological or environmental, right? And that's what causes or that's what, gives people their predetermined mental health, whatever, right? Later on in life. But now there's another aspect with the prenatal aspect, which I've always wondered about. I've always been like, I bet you there's a lot more to those 9 months than
Mm,
than we know
yeah.
of, than is common knowledge. But yeah, so that adds a whole other aspect to it. It may not be just biological or environmental. In fact, there's that other aspect of like what happened, during the pregnancy that may have caused this or this, right? So that's
Yes.
so interesting. I also think of expectant mothers that work stressful jobs. Do you think that would
Yeah.
affect the child?
Oh, good. I actually don't know the research on that. But, if you think about the state of your own well-being,
Mm,
um, and your own nervous system, that when we look at co-regulation, so the ability to regulate a child or someone else when we're feeling heightened,
right.
it if we're heightened and we're in a close attachment relationship, right? So when I work with parents and I say, if you want to support your child through their emotional distress,
Mhm.
you need to tune into your own emotional distress first.
Mm.
because in that close attachment relationship, the child is tuned into the adult, into
Mhm.
their caregiver.
Mhm.
And so a heightened adult is not going to be able to calm a heightened child.
Oh,
A
that's so
calm
true.
adult will be able to calm a heightened child.
Right. Right.
So for us to invite calm into a child, we need to be calm, right?
Right.
So our state and the state that we're in terms of our nervous system and our own emotional regulation, does impact then others that we're in close relationships with.
Yeah, that's, so much responsibility to the parent
It's
as
a
well,
lot.
you know? It
It's
really
hard.
is.
It's hard, and, I say to parents, "Look, there's no expectation that you're gonna be calm 24/7. It's unrealistic, it's not possible.
Right.
You're gonna escalate, you're gonna get angry, you're gonna yell, you're gonna have those moments
We're
where."
human, yeah, and we also don't wanna bottle our own
Right?
feelings up too much either because, that
No.
could lead to other mental health conditions as well, so
And we want to normalize for kids different emotions, and
Right,
so
right.
it's important for kids to see their parents in various emotional states and how they deal with that,
Mhm,
and learn how to deal with that. That's
mhm.
really important modeling.
Yeah,
So, if I see my parent angry and I learn how they manage that anger, I then learn how to manage my anger through
right.
observing that. So that's
Absolutely,
really, really key. There's no expectation to just be calm and
right.
soothing and regulated 24/7. It's just unrealistic.
Yeah, again, another reason why it's so important to go on the journey of self-healing and, healing your childhood traumas. It affects your romantic relationships. It will affect your children, it will affect your pregnancy, like everything pretty much it can affect. So it's so important to learn about this and be aware and heal. And I actually have to say that I am living proof actually that you can heal from it because I used to have an avoidant attachment style and now I have a secure attachment style. I've done multiple tests on this and been in multiple relationships. So I definitely had an avoidant attachment style. I have had childhood trauma, quite a bit of it, and I saw it play out in my avoidance.
Mhm.
And now I am at a secure place, and that's something that I can feel very happy and proud about. And, so it is possible. But I also
Yeah.
have been on the journey of self discovery and healing for God knows how many years, like for
Yeah.
forever, and I also know that it's not gonna stop and it shouldn't stop, We're always changing and evolving. So it's not something that you're like, "Oh, okay, great. I did this for 6 months. I'm
That's
cool. I'm
right.
cured." It's not like that at all.
It's
So
not like that. And self-discovery is a lifelong journey, and I say that healing is too, because we always are learning more and more about ourselves every day, and
mhm,
what works and doesn't work for us, or what we do and don't want.
right.
And that's part of the healing journey.
Right, and we don't stay stagnant, it's otherwise life is boring. So
That's right.
yeah, but absolutely. So thank you so much, Monique. Yeah, any last words of advice to everyone out there? What if someone maybe going through childhood trauma? What would you tell them? What should they do?
To reach out for support. Support's going to be the key factor in how your healing journey will look, and whether that's informal through family and friendship, or formal through therapy and services. It's really important to know that it's okay to ask for help, it's okay to reach out for support. It's a key factor in the healing journey for childhood trauma. So do know that there are people out there like me, who are trained in this. And so, there are people who can support your needs, and you might think that there's no one out there who can help. But there are a lot of trauma therapists who are specifically trained in trauma to be able to support and assist that healing journey. So, my recommendation is to definitely reach out and find support.
Awesome, Monique. Awesome. And where can everyone find you?
So I am on Instagram at the_mindful_psychologist. I don't work in private practice at this stage, so it would be just getting information from me from my page at this stage. Um,
Well, great.
but
Well, they can watch our IG live and all that
yes,
too on
yes,
Instagram. So
and I'm
yeah,
always sharing trauma-informed information on my page, so
awesome.
definitely, follow for trauma-informed content on there.
Thank you so much, Monique. It was so
Thank you
great
for having
chatting with you.
me.
Of course. Hope you have a great day. Have fun on your walk,
Thank
run.
you. Thank you. Thank you so much, and Serena, I really appreciate you inviting me onto your platform to have these conversations. I really, enjoy being able to, bring awareness to the community about trauma, so thank you so much.
Yeah, of course. Me as well. I've really enjoyed our conversation. Thanks for educating everyone. And thank you, everyone, for tuning in. I will see you
Yes,
next time.
bye.
Bye.